Yes, we do.
All right, so today we're going to talk about mindfulness and whether or not it can or how it can help potentially combat the impact of implicit biases. So as I said, so I want to start with this slide because part of when we put in for any kind of professional ethics CEUs, ethics and supervision, I always end up with a request to put in extra detail to justify that particular session and those specific types of CEUs. So this is part of why I'm starting with this slide. Professional impairment is a major ethical concern, and our topic on it touches on it in several ways. One of those ways is that burnout and compassion fatigue can interfere in our ability to perform at our best. Secondly, it's as a society, we have this expectation for healthcare providers to manage patient care in a way that's unaffected by or unbiased by the socio-demographic characteristics of the people they serve. Patient encounters, clinical assessments, treatment recommendations are all expected to be unbiased. And while we know that healthcare providers are in fact human, these expectations are truly aspirational. But when we fail to address burnout and/or bias, we're opening a door to unintentional harm towards patients. So cognitive load. Cognitive load is the amount of mental activity imposed on your working memory from factors in the environment, things like competing tasks, our physical mental state. Think of it as the amount of mental energy that it takes to provide care for patients. There's many sources of cognitive load, a lot of which are organizational and structural in nature. So from fatigue, which may be individual, but staffing, workload times, productivity pressures, documentation, using an electronic record, patient complexity, having a high caseload, individual patient interactions that are maybe challenging. And the more cognitive load, the more likely it is to cause burnout. The detrimental effect of cognitive load, impaired cognitive performance by clinicians is very well documented. And all of these do contribute towards burnout because it's pushing our cognitive load beyond our capacity to cope. All humans share a very highly adaptive cognitive strategy to make the world more manageable by using categorizing and generalizing to simplify the massive amount of complex information we're given. Clinicians specifically rely on a number of medical heuristics or shortcuts that facilitate decision-making. And we've talked plenty before about various cognitive biases and their influence on our perception. So there's a list of them here. And we've talked definitely about framing before, anchoring biases. And these are things that we all use in different scenarios. Media plays into these biases in order to sway our opinion on particular things. A category of cognitive biases are stereotypes. So those implicit biases, that some of which are about socially stigmatized groups. Biases impact our clinical judgment and decision making. And stereotypes might bias a provider's interpretation of a patient's behavior and/or symptoms. It could bias our expectations about whether or not a patient will be adherent or less adherent to medications or treatment recommendations. It can bias our medical decisions and also adversely influence the quality of the overall encounter. And when we're facing a high cognitive load, our ability to reallocate our attention is hindered. So we're not as efficient as shifting our thoughts to more intentional, conscious, effortful thought, which causes us to be more likely to slip into utilizing cognitive shortcuts and potentially acting on or activating implicit biases. So there's some research that shows that mindfulness might be an individual level strategy that might help mitigate the impact of implicit biases. Mindfulness, it is the metacognitive skill involved in intentional control, including paying attention to one's experience in the present moment, emotional regulation, self-awareness, and non-judgmental and curious orientation towards one's experiences. Mindfulness meditation is kind of that more formal seated meditation techniques that asks you to relax your mind, focus on your breath and body sensations. A variation of that is loving kindness meditation, which has been more associated with Buddhist type meditation practices and is often practiced in the context within mindfulness, but also aimed at cultivating compassion and warm feelings towards oneself and others. There's also mindfulness-based stress reduction programs, which was developed by Jon Kabat-Zinn in the 1970s and is one of the most widely used mindfulness programs, serving as a blueprint for many programs nationally. So that mindfulness-based stress reduction program consists of engaging in guided meditations, cultivating non-judgmental awareness. And the traditional program is fairly lengthy. So a large time commitment of 2.5-hour weekly group sessions, 45-minute individual daily sessions, and then a full day retreat. So quite intense, but thankfully you don't need that level of an intense program in order to benefit from mindfulness. Mindfulness has been shown to reduce stress and cognitive load. Mindfulness requires us to pay careful attention to the present moment, thereby decreasing our, how much we're ruminating on thoughts and anxiety. In studies with healthcare professionals and even non-clinicians, studies have shown that mindfulness, loving kindness, and compassion meditation practices decrease our emotional distress. Studies have shown significantly lower levels of work-related stress, depression, anxiety, and burnout, increases in self-awareness, improved emotional regulation, improved focus, and even improved anger management skills. It's shown to improve relationships and a sense of social connectedness, and can improve our compassion satisfaction, self-compassion, and subjective quality of life. In a study that looked at specifically nurses, they saw resilience maintain at a fairly high level even 3 months after the mindfulness programs, which indicates that these mindfulness practices might actually gradually impact other coping skills that allow us to increase emotional regulation and help us decrease an over-identification with a situation or a stressful event. So aside from just the straightforward stress reduction, mindfulness meditation promotes an early awareness of emotions. So you're better able to engage in regulation before the emotional response becomes intense. It allows you to disengage from stress and stop so much over-identifying with an experience. Negative emotion is a common part of the activation of implicit bias, and by reducing reactivity to stressful or difficult scenarios, mindful individuals may find themselves feeling more relaxed and less susceptible to the negative emotions. Mindfulness can also help promote emotional flexibility, allowing for more control over how you respond to challenging situations. By becoming aware of and being able to regulate our biases once they're activated, that is going to be a key part in us reducing the impact of the bias on our behavior. Mindfulness can increase our ability to examine our experience without judgment, attachment, or aversion, and promote a positive, compassionate relationship with ourselves, which then can extend to others and potentially improve our relationships with loved ones, patients, coworkers, colleagues. Our improvements in our ability to listen attentively and be present during communication might help for person-centered communication with patients. It also may allow us and help us to engage more thoughtfully in perspective-taking exercises. In addition, careful attention to the present moment can promote a safer work environment as a whole, by being less distracted and more focused on the task at hand. So ways to practice, and there are, I'm sure, thousands, but it's critical to note before we wrap up this, that didactic, that mindfulness is an individual coping skill. It is not a solution for burnout. It is not a substitute for organizational or system level change. And all of those should continue to be explored in order to prevent the sources of workplace stress, the sources of increased cognitive load. Similarly, individuals cannot fully address implicit biases without addressing structural biases that are reflected in organizational policies and practices. So this is something that is one piece of not only looking at our own biases and allowing us to take some space for intentional self-reflection and awareness, but also to reduce stress and better cope, but it is not a substitute for any of the larger issues at play. It is one practice that might help us explore and combat our implicit biases, reducing stress, giving space, much more likely to be enhanced by intentionally doing other things too. So things like adding journaling with it, discussing it in supervision with colleagues, actually pushing to make some organizational changes that would be better for us and better for our already marginalized populations. And while time commitment might be a stressor or potential deterrent, especially if you think about that mindfulness-based stress reduction program, what research has shown is that it takes as little as 5 to 10 minutes of meditation a day over 4 to 8 weeks. And you can actually start to see decreases in compassion fatigue and emotional exhaustion, and improvements in self-esteem, self-compassion, and compassion satisfaction. So whether it's by using a technique like stop, take a breath, observe, proceed, focusing on the sensation of breathing and just bringing your focus back when your attention wanders, doing a body scan, focusing on physical sensations when you're eating chocolate, when you're washing dishes, when you're walking, when you're petting a dog, or using an app. I'm a big fan of the apps. So whatever the things are, just a reminder to be in the present and take care of yourselves. And hopefully that'll help us to better take care of everybody else.